Hello friends, I am Dr. Mayank Uppal. I am consultant in internal medicine at Sitaram Bhartiya Institute of Science and Research, New Delhi. And today we'll be talking about a very commonly encountered condition, especially in the summers and the monsoons that will follow. And that is diarrhea associated with vomiting and some fever. So these are the most common questions that the patients have to ask about this condition. One is that what is the reason for causing diarrhea for being more frequent in summers and in the monsoons that follow. So the reason is that most commonly the viral infections are the reason for getting a diarrhea, or as it is called gastroenteritis in medical terms, and followed by bacterial infections. And as the summer and then the humidity in the monsoon promotes the growth of virus and bacteria faster, you are more likely to get an infection from food and water, especially if you're not very conscious about the hygiene of food and water in these seasons. Winters are a little favorable because the bacterial and viral growth is a little slowed down, and so you may get away with a little bit of unhygienic food and water in winters. So, hence the reason for getting more diarrheas and loose motions in the summer seasons. Okay, so if you do get a loose stool and diarrhea episode or gastroenteritis, how long will it last and when should you really worry about it? Loose motions are a way of the body to purge the infection out from your system. So, ideally, we should not try to stop the diarrhea immediately by any medications. And very commonly, patients make this mistake of taking over the counter medications to stop the diarrhea immediately. The most important thing here is that you should try to keep yourself hydrated well while you're having these loose motions, because dehydration is the more worrisome outcome of diarrhea rather than the number of loose motions that you pass per se. So the loose motions, technically speaking, can last for up to 3 days to 5 days, depending upon the severity of infection that you have. And like I said, it is most important to keep yourself hydrated during that time. You should worry if the number of loose stools is progressively increasing. If you're feeling too weak to even walk, stand up, or if you're feeling dizziness, if you're having blackouts when you're passing stools, which means you're suffering from severe dehydration and electrolyte disturbances, and that is the time that you should visit your doctor. In the meantime, till you can visit your doctor, it is important to drink balanced rehydration solutions like ORS. At home, you can make lemon water with salt and sugar. You can have charge or any other fluid that is easily available for you. Avoid packaged sugary juices, etc., because they cause more dehydration. So these are the things to keep in mind. The next most commonly asked question is that the patients feel feverish or andruni bukhar, as many people will explain it while they're having loose motions and diarrhea. So while it is not uncommon for you to have some fever along with the diarrhea, because of course it's an infection which is causing the diarrhea, if the fever is less than 100, you don't have to get too worried about the fever. If the fever crosses, let's say 100.5 or so, you can have a paracetamol tablet safely. But if the fever persists, or if the fever keeps rising as it is worsening, it is again advisable to see your doctor for him to rule out any other severe infections which might be causing the diarrhea. Patients also very commonly ask what are the home remedies for fever and diarrhea, and what can we do before we decide to meet a doctor. So the home remedies for fever, like I said, one is if the fever is, let's say, 100.5 or more, you can have a tablet of paracetamol safely. The other things that you can do is to keep yourself hydrated. So a well-hydrated person will have lesser body ache, will have lesser chills with the fever. And the other thing is that you can have sponging done. Now, the important thing to remember here is people consider cold sponging as the solution, while cold sponging will not help with your fever. So sponging should always be with a room temperature water. It should never be with ice cold water or cold water. It should be with room temperature water to help you with the fever. If the fever is progressively getting higher, you've taken a paracetamol, you've done some sponging, but it is still not coming down and you're feeling uncomfortable, it is advisable to see your doctor. But if you can't do that immediately, you can also try doing a head wash or taking a bath with normal tap water. That will also help to bring your fever down immediately.